is that I would like to introduce you to the system, and I would like to guide you a little bit about your first Invisalign patient. How should you select the patient to start with, and also walk through the submission process. Okay, the first question is that why Invisalign? Why you should invest in Invisalign, and why you should study this course? From the marketing side, from the database, it shows that we have already treated 6 million Invisalign patients globally, and like 350,000 is Asian patients. So you cannot so you cannot reject this trend. You have to accept that it's coming. The clear treatment aligner is coming. So it's very good for you to start doing it today. Otherwise, if you don't start doing it today, in the next 1 or 2 years, you may be behind with your friends. And with Invisalign system is the technical most advanced clear aligner system in the world. And I will show you why later on. And from the clinical insights, we have 3 different things that different from other companies. The first thing is that we use the aligners. It's a clear custom-made removable appliance to treat patients. So we will call each plastic name is an aligner. So each patient will have a set of aligner which will help to move each tooth forward to the desired position. There will be upper aligner and lower aligner. And each patient will have their own sets of aligner in order to achieve the treatment plan. So if we speak about the aligner, please think of the clear removable appliance. If you have an example of the aligner there, please hand it to your doctors so they can try to test the difference between our aligner and other clear retainer. And the second thing is a clean check treatment plan. A clean check treatment plan is the plan that helps you to visualize the treatment process from the initial position to the end position. It means that you can see along the way from the start to the finishing point. With the clean check treatment plan, will help you to visualize, look at every angle of the model. You can switch it, you can open the model without have to do the treatment in real patient. So with the clean check treatment plan, will help you to plan ahead before you provide the treatment in patient. So when you come to the training course, you will heard a lot of the word clean check. If you heard the word clean check, please think about this one, the blue one, which you will get after you submit the case today. And the third thing that help us differentiate with other companies is that we have the customized features. We have the features that come with the aligner with the different shape. And the second thing is that we have the optimized attachment. Is the composite that we put on patient's teeth that help to achieve the tooth movement that you plan. And next thing I'll talk about Invisalign innovation. With Align company, we have been invest a lot in research and development. And we have been developed so many things that help you to achieve the desired movement you plan. So I'll start with the first one. The first one in 2009, the company had developed the attachment, which you can see in orange color, but in real patient it will appear the same color as the tooth. The orange color here, we call it an attachment. An attachment will help to create the force that you would like to make with that tooth. For example, if you would like to extrude one tooth. Then we will decide one attachment to put on that tooth that help to extrude that tooth. And in 2010, the company has developed Invisalign G3. Invisalign G3 is that they had invented the attachment and also the aligner feature that help with the rotation movement and the lingual root top movement. And the third thing, the company developed Invisalign G4. Invisalign G4 is dedicated into the group of patients who have the anterior open bite, which is more challenging. So they try to achieve the hard movement that anterior open bite case have. For example, if patient have the anterior open bite, it means their front teeth is slightly apart. So in order to treat the anterior open bite, the anterior teeth need to be extruded in order to close and make the anterior teeth contact. So with Invisalign G4 is a group of attachment that do that movement as such, is to extrude the front teeth. And in 2013, the company have changed the material that made the aligner. Before 2013, the material that we use is EX30. But since on 2019 toward today, the material that we use, we call it a smart track material, which is more flexible and also more adaptive to patient's teeth. In 2014, the company developed the Invisalign G5. Invisalign G5 is dedicated into deep bite patients. Invisalign G5 is a group of attachment that help to extrude the premolar and also the aligner feature that help to intrude the anterior teeth, which is the treatment plan in deep bite patient. In 2005, the company developed Invisalign G6 protocol. Is a group of attachment as well that dedicate into the patient that have to be treated with extraction case, and specifically with the first premolar extraction. And Invisalign G7, Invisalign G7 is an attachment or lateral incisor that help to control the movement of lateral incisor. And we also promote the one big aligner wear. And in 2017, the company have invented mandibular advancement for class 2 correction in teen patient. So from this slide, I just want to show you that the company has developed and also did a lot of research in order to be able to treat a variety of cases. So from now, you can use Invisalign to treat from mild case into the severe case. You can see the company have invented the software to treat with the open bite case, the deep bite case, and also the extraction case. However, since you just start treating the case, I would like to encourage you to start with a simple case first. And in the future, when you are more confident with the system, then you can use Invisalign to treat with a harder case. Okay, the next thing that I would like to talk about is the key differentiator our company with other clear aligner company. So with our company, we have 3 smart things. The first smart I would like to talk about is a smart force features. A smart force features is represent in the represent as an attachment and aligner features. If you heard a smart force feature, you just think about how they move the teeth. Okay, with the smart force feature, the first thing is an attachment. From this picture, an attachment will show into the orange shape here on the incisor. This one we call an attachment. It helps to create the force in order to achieve the movement you desire. From this picture, what it shows is that in anterior open bite case, you would need to extrude the anterior teeth. So in order to achieve that movement, the company know that you need to have some attachment on the incisor. So it would create the force to push from gingival to incisor in order to extrude the incisor and then close the anterior open bite. Each attachment have been designed depend on patient's tooth size and tooth width and also long axis. So with different patients, we have the different design of the attachment. And also in different tooth, incisor and molar, we have the different size and different type of attachment as well. Each attachment have been designed by the software, so you don't have to worry that you have to design your own attachment or not. It's no. If you submit the case, then the software will automatically design the type of attachment for you. So the attachment will put on tooth depend on your preference and depend on the initial position of patient, and also depends on the final position that you would like to get. So with this reading, they would calculate and put it into software. And then they will decide for you which type of attachment need to be put in and where to be put in. Okay, so with the attachment, it will show in red tape as in clean check. As I mentioned for you earlier, different tooth and also different movement will have the different type of attachment. So if you look at this picture, you will see the attachment in red, in lateral incisor, and in canine. We will have the different shape and different type of attachment. Because this is a two different tooth, and these two different tooth need a different movement. So you don't have to worry that you have to plan your own attachment because it will be provided by the software. So in real patient, if you already review the case and okay with the clean check treatment plan, when you order to manufacture the aligner, in real patient, what you have to do is that you need to put the attachment on patient's tooth. And in order to do that, the company will provide you an attachment template. As you can see in this picture, it will be similar with the aligner, but it is more soft and more flexible. You can use the attachment template to put the composite into the attachment that you have planned. You fill it in with the composite, and then you do the etching and bonding on patient tooth, and then you put the attachment template in. Then you light kill it. After that, you take the attachment template off. So you will get the attachment on patient tooth with the same shape and size as the plan. With the attachment, we have the two different groups of attachment. The first group is the optimized attachment on the left, and the second group is a conventional attachment on the right. I'll explain about the optimized attachment on the left first. So mainly with the optimized attachment, the function of it is to move the tooth. So with the optimized attachment, they will have the active surface and also the active passive surface. Optimized attachment will create the force in order to move the tooth in that type of your planned direction. So let's look at the first one. Optimize rotation attachment. This means that the function of this attachment will help to rotate. So if you look at its shape, it will have the active surface on this side, on the mesial side, in order to rotate this tooth to the distal. The next one will be the optimized extrusion attachment. With the extrusion attachment, you would like to move the tooth downward this position so that they have the active surface gingivally in order to create the push force from gingival to incisal and create the extrusion movement. So this is just the example to show you that optimized attachment, the function of it is to move the tooth. It will have the active surface and passive surface in order to move the tooth as the plan. And the second group of attachment on the right side is a conventional attachment. With conventional attachment, we'll have the different function than optimized attachment. With conventional attachment, mainly its function is to provide a more retention to aligner. So with the movement of the tooth, it only helps with the retention. So if you look at the plan and then you have the conventional attachment in a clean check plan, I just want you to know that the conventional attachment just help with the retention. So in example with the case that have a short crown height, with conventional attachment, it will help the aligner to retain in-patient mouth better. When you submit a case, the software will automatically provide you an optimized attachment, but the software will not provide you a conventional attachment. So when you get the clean check back, you have to review the case, and then you have to decide if this case will need more retention or not. If you think this case will need more retention, then you can order a conventional attachment to add it in. The next one I will show is an aligner features. This one just an example. Actually, with our company, we have even more features than this. This is just two features that I want to show you today. First feature is a power-rich feature. Power-rich feature is like a line here. It's like a pressure. It's like a dumpling area, which will create the lingual root top for the incisor. With the power-rich here, it will come with the aligner. So it will create the push force on gingivally into the crown. So it will add the lingual root top of the incisor. Another feature is a precision diagram. A precision diagram will represent as with this shape. It will be on lingua of the incisor. It will be a bug shape with the airfield. So what it does is that when patient bite in with the precision diagram, it will help to disocclude the tooth. So with precision diagram, it will help in the deep bite case that you would like to disocclude the posterior teeth in order to be able to extrude the posterior teeth more. So with precision diagram, mainly it's used for deep bite case. You can prescribe it into the case that you think you need to use it more. Okay, and the second smart I would like to show you is a smart track material. As I mentioned earlier, Our aligner is made from smart track material. And the benefit of the smart track is that it is more flexible and is more adaptive to patient teeth. With the smart track aligner material, this one is a study that the company did. They compared the smart track material with other aligner material. This graph will compare with force and so also with time. The gold line will represent other aligner material, and the blue line will represent the smart track material. So when you insert the aligner, if you use other aligner material, it will provide higher force than the smart track. At this point, patient may feel more pain if they use other aligner material due to the higher force. But you can see along the time passed by, other aligner material force has been dropped gradually so fast. So with other aligner material, when the time passed by, it doesn't have enough force in order to make the tooth move anymore. So with other aligner material, when patient insert the first time, they would feel more pain. And when the time passed by, the force will drop, which make that tooth doesn't move anymore. But with the smart track material, when patient insert for the first time, they will feel less pain due to the less force. And when the time passed by, the force is still there. So if the force still there, it means that it will also create the tooth movement. So with our material, it's less pain than other material, and also provide the constant force, which driving the tooth movement along the time passed by. The second one, this one is a study that compared between other material and smart track as well. What they did is that they put a blue ink into the aligner material, and then they put it into the dental form to see which material have a better fit. So with a better fit material, you will not be able to see the blue color. So from this picture, with the smart track material, you will see less blue color compared to the standard material. This one shows that the smart track material have a better fit to patient teeth. And the benefit of the better fit is that if aligner can grab around the tooth better, it will be able to control each tooth movement, which will result in a more predictable tooth movement than other aligner material. And the third one is the Smart Stage technology. So with the Smart Stage technology is an algorithm that they determine the path of tooth movement. So they design that with this case, which tooth should move first and at which rate that the tooth should move to provide the optimum force. So basically with the Smart Stage technology is like a algorithm that they calculate when to move and how many force that they should put in order to be able to move that tooth. So with the Ploi Smart, it will be differentiated us with other company. It's a smart force, smart stage, and a smart track material. Okay, and the next section, I will introduce that how does aligner work. Aligners will come in sets of patients. So with one patient, they will have a set of liner depending on the complexity of the treatment. With a simple case, they may have the less numbers of aligner. For example, for the simple case, they may need only 15 aligners. But with a complex case, for example, like a class 2 or class 3 case, they may need higher number of aligners, let's say maybe 40 aligners. So number of aligners will determine the complexity of the case. And when you provide the aligner to patient, you start from the aligner number 1 first, and then follow to aligner number 2, number 3, and 4, until you complete the set of the aligners. For one aligners, the recommended wearing time is 7 to 14 days. Depends on the complexity of the case as well. And each aligner, you have to tell patient to wear at least 22 hours per day in order to achieve the optimum time and also the optimum force to create the tooth movement as you plan. After patient finish with the first aligner, the tooth should move as the plan. Then you need to keep monitor if the tooth has moved according to the plan. If the tooth is moved as the aligner, it will provide the good fit of the aligner. But if you monitor the case and then you found out that some aligner doesn't fit anymore, it's a sign that maybe some tooth doesn't move as the plan. At that point, you may need to do additional aligner to redo the case again in order to treat all the teeth to go as you plan. With the treatment process of Invisalign, so first step is that you select a patient, and the second step is that you submit the case. Once you submit the case, you would need 3 things. The first thing is a photo of the patients, intraoral photos and extraoral photo. The second thing you will need is a PVS impression of the patient or the scan file of the patient. And the third thing that you will need to have is a prescription form, which I will introduce you how to write it later on today. So with these 3 things, with the photos, impression or scan, and the prescription form, with these 3 things, then you can submit the case. Once you submit the case, it will take, with the scan, it will take around 3 to 5 days in order to receive the first clean check file. But with the PVS material, you may have to wait maybe 3 to 4 weeks in order to receive the first clean check treatment plan. After you receive the clean check treatment plan, you have to review it, if it's a good plan or not. You have to modify the plan according to your desired result. You can modify the plan as much as you want until you get the plan that you like. And then if you already get the plan that you like with the final position that you like and also with the movement of the tooth that you like, and then you click the approve button. After you click the approve button, it will run to manufacturing process. They will manufacture the aligner from the first aligner to the last aligner. And then they will ship you the whole set of aligner. And then at that time, you can appoint the patient to start the treatment. In that case, you may need to put some attachment on by using the composite into the attachment template and bond in patient teeth. And also in some case, you may need to do the IPR or interproximal reduction. So with the first visit, you can do the attachment bonding and also interproximal reduction, and then you provide the aligners to patient. You can plan to provide maybe 2 to 4 sets of aligner to patient first, and then appoint them to monitor if they wear the aligner properly or not, and then also monitor if the tooth has moved as the plan or not. And then the treatment continue like this. Like you give another 4 sets of aligner to patient, and then appoint them for maybe 1 month or 2 months, and then keep monitor the case maybe 2 months, every 2 months if the tooth move according to the plan, until you finish the set of aligners. After you finish the set of aligner, then you can remove the attachment and also do the impression or scan, and then order a retainer. And then patient must wear the retainer a lifetime in order to maintain their dental position. Okay, and the next part I will introduce about the patient selection. So what you should think about when you first meet the patient, you have to think about the diagnosis of this case first. So with the diagnosis, first you should discuss with patient what is their chief concern, what they would like to correct. If their concern is only anterior teeth, or if their concern is a midline shape, or if their concern is a protrusion. And then you write it down of patient's concern. Patient profile. If patient have a protrusive profile, then you may plan to retract it in order to create a straight profile to the patient. And the third thing you should think of is the type of mouth occlusion. So you check in vertical if patient have the open bite or deep bite, and then you also check in sagittal, in transverse, and then you that which type of occlusion patient have. If patient is a class 2 or class 3 occlusion. And the fourth thing you have to think of the anatomical limitation. You should check if patient have the thin labial bone or not. And you also should check about the gingival thickness of the patient. Because if patient have the thin labial bone and patient is a thin biotype, you shouldn't do much of the proclination and you shouldn't do much of the expansion, because otherwise it would create the gingival recession to the patient. Another thing you should consider is the buccal corridor of the patient. If patient have the large buccal corridor, it means that when they smile, they can see the black gap on the angle of the mouth. So with patients who have the large buccal corridor, then you may want to do a little bit expansion to them. So we'll provide them a broad smile. And also you should check if patient have the black triangle on anterior teeth. And check like if patient have the implant or impacted tooth. Because with the implant and impacted tooth, these two things you cannot move. So if patient have the implant and impacted tooth, you have to write in the prescription form that this tooth should not be moved. Once you gather all the information about the case, when you got all the diagnosis of the case, then you can plan it properly, how you would like to treat it, how would you like to solve patient concern. So the diagnosis is very important that you need to be able to achieve first before proceed to the next step. And this one is an example of the case that would be a good case for you to start. This one is a case with a dental class 1 occlusion and with a mild spacing. In the upper row is the before treatment photos, and the lower row is the after treatment photos. This one is a good case to start because it's a mild case and patient have the molar in class 1 in both sides. On the right side is molar class 1, canine class 1. And on the left side is molar class 1 and also canine class 1. And the only main concern of patient is the spacing between central incisor and also the spacing between the lower lateral incisor and lower canine. So this case can be treated quite easy by only retract the anterior teeth to close the space without changing the anterior-posterior position of the teeth. So mainly what we did with this case is that we only retract the anterior teeth and then we can achieve the good result. So with a good case to start, it will be the case that have like no anterior-posterior change. It means that molar stay at the same classification. If patients start with molar class 1, that would be easy if you maintain it at that way. And the second thing is that because of the retraction, it's mainly a crown movement. It's not a root movement. So with the crown movement, you can achieve the movement easy with the aligner because the aligner mainly they cover the crown. So if they cover the crown, it means that they can grab around the crown and they can create the force that need to provide in order to do the crown movement. And the third thing that is a good case to start and easy to do is because patients have a long clinical crown. With a long clinical crown, it will provide more space, it will provide more area of the aligner to be covered. If aligner can cover more, it means more predictable to movement of that case. So this one is a good case for you to start because you can see the result very obvious and also the treatment time is very short. It may take only like 3 to 4 months to close all the space with a good finishing as well. Okay, so the good case for you to start, the clinical indications are the long clinical crown, and mainly the movement should be focused on the crown movement. And it should be a non-extraction case with a mild improvement and no or mild MP change. This one would be more easy for you to start with. However, we have the tools that can help you to differentiate between the easy case and the hard case. The resources we have is an online evaluation tool for you that you can type in the about the case and then they can evaluate for you that your case is an easy case or if your case is a hard case. And it's a free, so you can access into the online evaluation tool. You can use it to evaluate all of your potential cases, and then you can decide it later if it's a good case to start. And the second tool we have is a global Invisalign gallery. A global Invisalign gallery they gather all of the Invisalign case all over the world. And you can learn from that case. You can look at the case and you can read all the information, how they achieve the final result, and you can use that knowledge to interpret with your own case. I'm sure the online staff can show you how to access the online evaluation tool and also the global Invisalign gallery. Okay, so if you have the time later on, maybe today or tomorrow, you can try to play with the Academy tab. So once you log into your Invisalign website, or we call it in short is an IDS. Once you log into your IDS, then you can learn a lot more about Invisalign by click on the Academy tab in here. And then you can read a lot of the information in the clinical topic. They will explain in detail in all type of the case. Deep by case, open by case, class 2 or class 3. And if you would like to access the online evaluation tool that I mentioned to you earlier, you can click on the Academy tab, then choose clinical topics, and then choose Invisalign process, and then go to product and patient selection. And then they will have the treatment evaluation tool for you. Then you can click start here. Then it will route to the online evaluation tool for you to put all the information about the case. And then they will interpret the case for you. They will divide the case into 3 categories. First one will be the symbol, represent in green color. It means that this case is a simple case. It's a very good for you to start with. The second category is an intermediate, represent with the blue color. It's a moderate case. It means that a little bit challenging for you, but it still be able to do. And the third category is a black, which represent a complex case. With the black or complex case, it means that you may need a little bit more experience, and also you may need to incorporate other auxiliary tools in order to be able to achieve the final result that you design. So if you have time, you can play with the online evaluation tool later on, and then you can review which type of your case fall into which category. Okay. And with this one, they will show how do they divide that case into 3 categories. So they incorporate the movement into the parameter. So with Invisalign parameter, they have divided into the simple, moderate, and the complex as well. So with Invisalign parameter, it falls into the green category. It means that with this movement, Invisalign can treat definitely for sure. For example, with the case with crowding that have amount of crowding less than 6 millimeter, this one will fall into the category of the green, which means it's a simple case to start with. If patient have a crowding less than 6 millimeter, it means that this case is simple to treat with Invisalign. But with the case with crowding more than 8 millimeters, it falls into the black category. It means that this case may be a little bit challenging. You may need to plan it more properly. This one is just an example for you. On training day, you will receive the clinical booklet, and in that booklet you have the parameter for you to review and then go through each movement of each tool. Okay. So far, if you have any question, you can tell Kun Chu or Pom Pam, and then later on, if we finish all the session, I will answer all the questions. So the next part I would like to introduce for you is about the Invisalign package. Because today, once you submit, you have to choose which type of package you would like to submit the case. So with Invisalign, there are 4 packages for you to use. Start from the simple one to the more complex one. So first package is an Invisalign Express package. with Invisalign Express package, it's good for the case with a very mild case, like a relapse case, or the case that require only minor tooth movement. With the Invisalign Express package, the maximum number you will get is 7 aligners. Seven upper aligners and lower 7 aligners as well. So maximum number of aligners for Express package is 7. The second package is a light package. With a light package, it's a little bit more harder case, maybe like mild crowding that can be resolved within 14 aligners. The maximum number you will get with the light package is a 14 aligner. The third package is a moderate package. A moderate package would be a little bit more harder case, like a mild to moderate crowding, or the case that you would like to correct the anterior posterior teeth, and a case with a mild open bite and a mild deep bite. With the moderate package, the maximum number of aligner you will get is 26 aligner. And the last package is a comprehensive package. A comprehensive package would provide you a wide range to treat your case. It can range from moderate to severe crowding case, or a case with a moderate deep bite or moderate to severe deep bite. It can be able to treat with comprehensive package. With comprehensive package, you will get as much number of aligner as it needed. So today, if you first start, then you can check if your case is a simple case, like very mild, need a small number of aligner, then you can use maybe like light or moderate. But if your case is a little bit more challenging, if it need to correct the deep bite, if you need to intruded teeth or extruded teeth, then you can go with the comprehensive package. And by submit today, if you choose any package, it doesn't mean that you have to approve with that package. For example, if today you are not sure which package you would like to use, then you can submit with the comprehensive package first. And once if the clean check come back and it show that with this case only need to use only 14 aligners, then you can change your package from comprehensive into the light package. The charge that will be applied once you click the approve button. So when you submit the case and during you review the clean check, you can change the package, upgrade the package or downgrade the package as much as you want. Just before you wanna click the approve, you have to make sure that this is the package that you would like to use, and you will be charged according to the package that you click the approve button. So no need to worry about today. If you are unsure which package you want to use, you can submit with the comprehensive package first, and then you can downgrade it later on if the number of liner is less than you expected. Okay. The second thing that comes with the package is an additional aligner. As I mentioned earlier, is that there will be some case that the tooth doesn't move according to the plan. It may cause from the patient compliance, or it may cause from the complexity of the case. With that type of case, you need to stop the treatment and redo it again. By redoing it, it means that you need to do another set of aligner. So another set of aligner, we call it additional aligner. With additional aligner, it's like you do the case all over again. You do the new impression or scan, you do a new photos of the patient, and then you submit the case by click additional aligner, and then you review all the clean check again before you click the approve button and then order them to manufacturing a new aligner set. So with each package, they have the number of additional aligner they allow. So with the express package, with the maximum number of aligner of 7 aligners, with the express package, they will allow you to do 1 set of additional aligner. And with the light package, with the maximum number of 14 aligners, they will allow you to do 2 sets of additional aligner, include with the price. And with the moderate package, with the maximum number of 26 aligners, they will allow you to do a limited set of additional aligner within 2 years. And the comprehensive package, they will allow you to do a limited set of additional aligner within 5 years of the treatment. Okay, so next would be treatment submission. So let's take some question if you have. Like if you have some question, please tell to Kun Chu and also to Pom Pam, and then they can help to type it into my line, and then I can help to answer some of your questions.
Anybody have?
Are we having any question, Kun Chu and Pom Pam? If we have, I can answer that question now before we continue to the treatment submission part. But if you don't have any question, please also type in the line. So I will continue. In 1 day, patient must wear at least 22 hours. It means that they put the aligner in their mouth all day long, except when they eat and when they brush their teeth. Okay, and the second question I got is that does patient have to wear a retainer lifelong? So yeah, actually it would be the same as in conventional treatment with the braces. If patient would like to maintain their occlusion, then the retainer is a required. But after patient finish the Invisalign treatment or any other orthodontic treatment, on the first 6 months, they should wear the aligner whole day long. And after 6...
They will back up. Wait.
And then you click next to read more about it. And this is the parameter that I showed you earlier. It also show in the IU. Okay, so the Vienna side is back, so maybe I'll carry on with the submission process. Okay, so with the submission process, you need to have 3 things: photos, and then PVS impression or scan, and the prescription form. Okay. With the photos, we have the tool that you can use. We call it Invisalign Photo Uploader. You can download this application and use it in your mobile. With Invisalign Photo Uploader or IPU, once you download it, you can put in your username and password, the same as you put it in your computer. And you can use this app to take a photo of the patients and automatically link to the Invisalign doctor site. So you can create new patient by click plus button, and then you key in patient's name. After that, all of your photo that you've been taken by your mobile will automatically go to the IDS. So when you open your computer, your photo will appear in your IDS. So it will reduce your treatment time. The photo that required to submit with the extraoral photo is a smile photo, profile photo, and a repose photo. A smile photo is very important because you can check patient's midline in smile photo. If patient have a midline shift, you can look at the smile photo and then tell the technician which way to move the midline to. And with an intraoral photo, you need to have the upper occlusal view, lower occlusal view, the right buccal view, anterior view, and also the left buccal view. And please make sure that when you take a photo, when patient's bite is the correct bite, that you would like to proceed with the treatment. Make sure they bite down properly, because the technician will need to use the photo in order to set patient's bite. If you would like to make sure that they set it correctly, another thing you can do is that when you take the upper occlusal view, you can ask the patient to bite articulating paper or the color paper mark, and then they will mark down the occlusion of the upper arch and the lower arch. And you can take a photo that have the articulating paper. With this way, you can make sure that the lab will set the bite more properly. Okay. Okay, so next is a submission step. With the submission step, first, I would like you to do is that you should set your clinical preference. So with the clinical preference, it will be on the right corner here. It will be hello and will be your name. And then you click here. And then you go to clinical preference. What is clinical preference? Clinical preference, this one will apply to all your cases. It's just that you tell the technician the way you like to treat your case. Each doctor may have the different preference. So if you have your own preference, you can set or key it in here, and then it will apply with all your cases. You can set the clinical preference today and then change it tomorrow. It's up to you. But the case after you set the preference, they will do according to the setup. So with the clinical preference, normally the doctor will set only one time. But in the future, if they change their mind and they have like other preference, they can go back and then reset it again. So with the clinical preference, they will ask you about, first is a tooth numbering. Which type of the tooth numbering you use? They have universal, Palmer, and FDI. Then you choose like which tooth numbering you would like to use in order to communicate with them. So for example, if you would like to change to universal, you can click on universal here. But if you use FDI as in Thailand, then you can click in FDI here in blue button. And the second one, they ask about the passive aligner. So there will be two types of aligner, mainly active aligners and passive aligners. So active aligners is the aligners that create the movement of the teeth. But a passive aligner, it will be provide you in order that if that case upper arch and lower arch treatment doesn't require the same number of aligner. For example, upper arch may need like 40 active aligners, but lower arch may need only 30 active aligners. Then with this question, they are
voice. Sorry.
Okay.
Okay now.
Yeah.
Okay. So I can carry on now, right? You can hear me clearly, right?
Yes.
Okay, thank you. Okay. The next question is about the IPR on first clean check treatment plan. IPR stands for interproximal reduction. So this question they ask like if you would like to get the first clean check treatment plan that have the IPR on. So I think you should click yes because this way you will get a better clean check than without IPR. So with the default, it will show in blue color. But if you would like to change to no, you can change to no. It's up to you. But normally, what I've experienced, most of the doctors would like to click yes because they would like to get the IPR on the first clean check treatment plan because they show a better final position of the tooth. And the next one, they ask about the stage 2 start IPR and stage 2 start attachment and stage to do extraction. They ask whether if you like to delay stage to do the IPR. Like some doctor would like to do the IPR later on because they would like patient to get used to the aligner first without like cutting their teeth on the first visit. So some doctors choose to have like delay to stage 3. But some doctors say like they would like to start the treatment faster and get the and treat the and finish the case earlier. So they choose no delay. The second one is a delay attachment placement. If you would like to put the attachment in the first visit, or if you would like to delay attachment placement into later on. So normally what I saw is that normally they choose to have no delay, except some doctor would like patient to get used to the aligner first without having any attachment on patients, so they can choose the delay as well. And the next question is the delay stage of extraction. So in case that you have an extraction case, if you would like to extract the tooth on the first visit, or if you would like to delay to later on. So you can click no delay here, but in other specific case that you would like to request a delay, you can mention in a prescription form. And the next question is a contact for open space. This one they ask that if the patient have an edentulous space more than 4 millimeters, if you would like to get the shape contact, it will represent as a shape of that tooth. It will come with the aligner, and then you can put some composite into the contact. Okay, I'll show you some pictures.
Already passed.
Okay, this one is a picture of the pontic. If you click that you would like to get the pontic, they will manufacturing the aligner with the shape of the extraction tooth. Like in this picture, this case is an extraction of first premolar. It will resemble the tooth in gray color. But if you click that you would like to get a pontic, then on that area, the aligner will come with the shape of the first premolar. And then you can put the composite into the aligner. And then when patient wear it, it will show more aesthetically. But if in this one, if you click no, on this area, it will appear as a flat teeth with no pontic. So there will be like a shape of aligner, canine, and then would be a flat aligner, and would be the shape of second premolar. So normally the doctor will choose to have the pontic because it's like for aesthetic reason. Okay. And the next question is the arch expansion. This one they ask like if you would like to expand the arch between the canine, premolar, and molar, or if you would like to expand the arch only between canine and premolar, or if you would like to expand the arch between premolar and molar only. And this one they ask about the expansion per quadrant, amount of expansion that you would like to do. If you like to do less than 2 millimeters or more than 2 millimeters per quadrant. And the next question is about the two size discrepancy. In the case that have the discrepancy between the upper arch and lower arch. For example, patient with the peg shape or lateral, they will have a smaller size of lateral incisor. So with the case like that, if you would like to create a space on distal of the lateral to do the restoration after the treatment, they ask like where you would like to put that space on. If you would like to put the space on distal to lateral, then click here. But if you would like to have the space between the lateral, a little bit on mesial and a little bit on distal, then you click here, leave space equally along the right long. And another choice you can choose is that if you would like to do the IPR on opposing arch to make the balance between upper arch two sides and lower arch two sides, then you can click to do the IPR of the opposing arch. And then there will be no space on the lateral. And the next one is the upper arch tooth leveling. They ask how you would like to finish the case with. If you would like to have the level of central incisor the same with lateral incisor, or if you would like to have the lateral incisor 0.5 millimeter gingerly than central, then you click here. Or if you would like to have the tooth leveling in gingival margin without carrying the level of incisor edge. If you click level gingival margin, it means that normally your case is a restorative case where you're planning to do the veneer at the end. So then you would like to level the gingival margin to be the same without carrying the incisor edge level. So normally doctor will go with level incisor edge, and then normally they choose to have the lateral 0.5 millimeter shorter than central because it would be more natural. Next question is about the aligner trimming. Normally, please choose to have aligner trim to CEJ line. This one will be more comfortable to the patient. The next question they ask about the for space closure treatment. Would you like to get a virtual C-chain at the end or not? So with the overcorrection is the additional number of aligners that will help to retract the tooth. We have two options for you. First one is that retract from tooth 3 to 3, from canine to canine to close all the space. Or if you like to get the aligner that close the space from first molar to first molar. So with the overcorrection aligners, it's a little bit confusing and it can be misused. If you don't understand it correctly, I think normally please choose to have no first. And then in some case, if you think this case need to have overcorrection at the end, then you can order in prescription form, or you can order in a clean check too. So for now, you can click no. And And the next one, they ask about your impression material in case if you send the PUS or if you send the scan, and if you couldn't get the last molar in, how you would like to proceed with the treatment. So the first one is that to proceed with virtually remove the distort portion out. So I think this one is better because it means that in the distortion area, they will cut out the distortion area in order to provide a better fit of the aligner. But if you choose the second one is mean that with the distort molar, you request them to visualize and then do the detailing by digitally, like draw the outline by digitally and make the aligner to cover that distort surface. If you choose this one, you may get some aligner fitting issue because it's like you request them to draw the outline out of the distort file, which they cannot do it properly. And the third one is that you ask them do not use your impression or scan at all. It means that if you have any distort, impression or scan, you will send a new one. So for this question, I think the best one to go with is the upper one, is to proceed to virtually remove the distort portion. It means that you will also get the aligner, but it will not cover to the distort area. This one you will get a better fit of the aligner. And the next question is about optimized attachment size. If you would like to get the regular size, or if you would like to get the largest size of attachment, there will be anterior teeth and posterior teeth. So normally doctors will go with regular size. So it would be by default is the regular size. But for some doctors who concerned about the attachment size because they think that the larger attachment may provide a better movement of the tooth, then they will choose to have the largest attachment that fit. This one is up to you as well. For now, maybe you can choose to have the regular size first, and then after you attend the training course by Dr. Hao, and if you would like to change the size of attachment, you can order in the clean check too. And the next question is about the AP correction. They ask about in the case that they don't have enough space in the tooth to put in optimized attachment and also the precision cut. They ask like if you would like to keep the optimized attachment or if you like to keep the precision cut. So normally you can choose to go by default protocol first, is to place optimized attachment instead of precision cut. And then if you get the clean check back and then you would like to change something, then you can change in the clean check too. Okay, so this is the clinical preference. If you change something, then you click Save Change here. Please be reminded that with the clinical preference, this one will apply with all your cases. So please don't be specific, just be in general first. And if you like to be specific, then you can write it in the prescription form. Okay, once you complete your setting here, then you can start to add new patient, is to submit. When you submit, you click here, add new patient, and then you key in, I'll do it as a demonstration. You key in your patient name. Okay, maybe TP, first name and last name. And MI stands for middle name. If patient doesn't have, then you can leave it blank. And then you click patient gender, and then you key in the date of birth. date, month, year, and then you click next to go to the next step. And the next one, you click the patient condition. This one is only for your general note. This information will not be passed to the technician. So you can click in the patient condition if they have the crowding or if they have spacing. You can click in the condition that apply. Once you finish, and then you click next. And then they will ask you to upload the photo. Then you can click the up here and then drag the photo into this one. Okay, and the next one they will ask you to upload the extraoral photo and intraoral photo. You can click the blue button to upload each photo in. The staff can help you later with the upload. And the next one will be the radiograph. You can upload the radiograph by adding the OPG and the cephalometric radiograph here. You can choose to upload now or upload later or no radiograph. Oh, okay, so sorry, it's too fast. Maybe I'll go back a little bit to the clinical condition. Okay, I'll reset for a little bit. Okay, after you click add new patient, then you fill in patient name, first name, surname, and this one MI is a middle name, so you can leave it blank. And then you click patient gender, male or female. And then you click the date of birth, you key in. And then you click next. And then it will lead to the clinical condition. So with this one, it doesn't pass the information to the lab. It's just for your own general note. For the clinical condition they have crowding, spacing, class 2 dip 1, class 2 dip 2, class 3 open bite, cross bite, deep bite, narrow arch, flat teeth, overjet, uneven smart or misshapen teeth. So you can click the clinical condition that apply to your case. But if there are no specific condition, then no need to click anything. It's fine to leave it blank also. Okay, so I'll click just as an example. For example, if my case is a crowding case, then I click crowding. And in here is a general note that you would like to add for your own understanding. For example, maybe patients have to go abroad on 1st July, for example. Then that's your own general note. You can add in anything that you would like to add. And then you can click next. The next one is a photo. It's a portrait photo. You can choose to upload the patient portrait photo now or upload photo later on too. But if you would like to submit today, you have to click to upload patient portrait now in order to submit all the needed information. In here, you can click on the blue icon and then choose patient photo. I'll use mine as an example here as a photo, and you can choose to edit the photo. In case that you take it the wrong side, you can choose to rotate it any side that you like. If you finish, then you click next. Okay, and the next one that you have to upload is an extraoral photo on the right side and the photo with the repose and a smiling photo. And 5 intraoral photo is an upper occlusal view, lower occlusal view, right buccal view, frontal view, and left buccal view. So you can choose to upload the photo now. Individual image is mean that you would like to click and upload one photo one by one. But if you choose composite, it means you already create a template that have 8 photos into one, and then you like to upload it at one time. This is just an example. Okay, so I'll choose to upload photo later. Once you finish the uploading, then you can click next. Okay, next is a radiograph. With a radiograph, it's not a requirement. It means that if you have the patient's radiograph, you can upload. But if you don't have the radiograph, then no need to add it in. It's not a requirement to submit. But if you have the radiograph and if you would like to upload, you can click upload the radiograph now. And then this one you can upload the OPG radiograph. And this one you can upload the cephalometric radiograph. But if you don't have the radiograph, you can choose no radiograph. And then click next. The next one is that if you submit via PVS impression or by scan. If you submit by PVS, you click here, PVS impression. But if you submit by scan, then you click here. Then you can search the name of the patient of that case. And it will show for you to click here. Then you click this file scan of that patient. And then you can preview the file here as well. You can click on the file scan and then review the file scan again if it's the correct one. Okay, once you finish, then you click next. Okay, so this one you already create the patient information, the name, the date of birth, and then you will get the patient ID number. Is a very important thing that you use to communicate with PDM or communicate with Udom Smith team is this number, patient ID number, or we can use PID. It will be 6 digits. This case is 9182433 is a PID of this case. You use this number to communicate with the team. In case you have the problem with this case, you provide them the PID number and then we can check for you. Okay, once you finish all in here, then you go to here, submit prescription. Then you click start. Okay, once you start, they will ask you to select patient type. They will have adult and teen. For the adult, it's applied to patient with permanent dentition. And with the teen, it will apply to patient that have in the mixed dentition. So if your patient have a fully erect permanent dentition, then you can click adult. With these two types of patient, doesn't have the different charge. They will have the same charge. The charge will according to your product only. It will not according to your patient type. Okay, so I'll click adult if my patient is adult. And then they will ask you about the product type. there will be Invisalign clear aligner, is that we use to move tooth, or a retainer, that a Vivera retainer in retention period. If you already finished the orthodontic treatment and then you would like to do a retainer for patient, then you can click on Vivera. But for today, we will click the clear aligner because we would like to do the orthodontic treatment first. So you click select here. The next one, they will ask you to choose between 4 package. As I mentioned before, there will be comprehensive package with a limit number of aligners, moderate package with a maximum 26 aligners, light package with a maximum 14 aligners, and express package with a maximum 7 aligners. So you can choose any package today, but you can change the package later on. You can change the package as much as you want just before you click the approve. So today you can choose the comprehensive package first and wait for the clean check to come back, and then you can decide it again if you would like to change into more into moderate package or light package. It's up to you. Okay, so I click the comprehensive package. And then this one is the prescription form. The prescription form will be specifically for the case that you would like to submit. So this one you have to be specific for that case. They will ask you 10 questions here. First question is they ask if you would like to treat upper arch and lower arch. If you would like to treat both arch, then you click both. But if you would like to treat only upper arch, you can click upper. Once you click upper, they will request you to choose between nothing on opposing arch, or diagnostic model on opposing arch, or passive aligner on opposing arch. If you would like to treat upper arch only, and if you don't want anything on lower arch, then you can click nothing on opposing arch. But if you would like to treat the upper arch with aligner, and then maybe you plan to do the braces on lower arch, then you can click diagnostic model on opposing arch. Or if you would like to do the upper arch only, and if you would like to get the passive aligner on opposing arch, you can click the passive aligner on opposing arch. Okay, so normally we treat both arch, so I'll click both, and then I click next. The second question that you have to answer is is there any tooth movement restriction? So this time you have to check your patient if there are any bridges, if there are any ankylosed teeth, or if there are any implant. If there are any bridge, ankylosed teeth, or implant, this tooth or teeth cannot be moved. So you have to review your case. For example, if your case have an implant on number 16, you have to click on number 16 that this tooth is an implant. It should not be moved. So you have to review by yourself. If there are any tooth that should not be moved, then you click on that tooth. So the technician will know. And when the clean check come back, they will not move that tooth. Okay, and the third question is about attachment. This question they ask if you would like to place attachment depends on the software, or if there are any tooth that cannot be placed attachment. For example, if your patient have a crown, a metal crown, or a porcelain crown, or a veneer, then that tooth should not be placed attachment. If your If you have a case that have a crown on maybe tooth number 46, then you can click do not place attachment on tooth number 46 because it's a crown. And with a crown surface, a metal or porcelain, it cannot bond with a composite. So you should not put attachment on the tooth that have a crown. Okay, so you can review your case. If there are any crown, then you click do not place attachment on this teeth. If you complete, then you click next. And the fourth thing is about the anterior-posterior relationship. With this question, they ask about the final goal that you would like to achieve. If you would like to correct the canine relationship, or if you would like to correct the canine and molar relationship. So in this time, you have to check your patient and you have to diagnose if patient have canine or molar class 1, 2, or 3. And then you have to decide what final position you would like to get for that case. If your case start with canine class 2 and molar class 2, and if you decide that you would like to treat that case to get canine class 1 and molar class 1, then you should click improve canine and molar relationship. R stands for the right side, L stands for the left side. If you like both sides to treat to canine and molar class 1, then you can click improve or correct to class 1 on right and on the left. But if you check your case and you think that their canine and molar relationship is good enough already, you can choose to maintain the canine and molar position too. So this one would be depend on your decision that how you would like to finish the case with. If you would like to finish the case with class 1, then you click either improve or correct to class 1. This would mean the same thing. In my example, I'll click correct to class 1 first, so you can see that you have to key in other information too. So here is your goal, how you would like to finish the case with. If you would like to finish the case with canine and molar class 1, then you click correct to class 1. And here on the bottom part is how you would like to achieve your goal. So my goal is correct to class 1. Then I'll have to click that how to achieve my goal. What kind of movement that I would like to do to get to canine and molar class 1. So there will be 3 options to choose. First is to correct to class 1 by do a interproximal reduction on the posterior teeth. The second option to do it is to use the elastic by adding an elastic, maybe class 2 or class 3 elastic with a jump of the jaw in a teen patient to correct to class 1. And the third option is a sequential digitalization. A sequential digitalization is a movement of a tooth one by one. They will digitalize the second molar first, and then digitalize the first molar, and then digitalize premolar, and then retract the canine, and then retract the incisor. So you can choose between these 3 options. You can choose more than one if you think it's appropriate, or if you would like to do just one option, like only do posterior IPR, then you can click that one. In my case, I'll choose posterior IPR and sequential digitalization, just an example. Once this one complete, then you click next. Next question is they ask about how would you like to finish the case with. And then you check the overjet of the patient. If overjet of the patient, if the initial overjet of the patient is good already, then you can choose to maintain the initial overjet. But if you check and the overjet of the patient is large and you would like to correct it, then you can choose to improve the overjet with IPR. But if you are not sure that you would like to correct the overjet or not, and if you would like to let the technician do it for you first, then you can choose show resulting overjet after alignment. Okay, so show resulting is mean that let the technician do it for you first. Maintain is mean that you would like to maintain the initial position of the patient. But improve is mean that overjet of the patient is not good. Either it's too small, too tight, or either it's too large overjet and you would like to correct, then you click improve. Once you finish this one, then you click next. Next question is about overbite. So with this one, you have to direct the case if it's an open bite case or deep bite case. I'll explain one by one. Okay, so first choice is that if you are not sure what kind of case it is and you would like the lab to do it for you, then you can choose show resulting. But if you review the case and you think the overbite of the case is good enough, then you can click maintain. The next one is that if you look at the case and it's an open bite case and you would like to correct it, then you click correct open bite. Once you click correct to open bite, they will ask you how you would like to correct the open bite. The choice is to extrude the anterior teeth only, and another choice is to extrude the anterior teeth and also to intrude the posterior teeth. So if you have the open bite case, you should look at the facial profile of the patient. If patient have a long face already, then you may choose to correct the open bite by extrude the anterior teeth and intrude the posterior teeth in order to reduce the long face of the patient to the normal size. But if patient profile is good enough, if they have the balance upper facial height and lower facial height, then you can choose to correct by extrude the anterior teeth only. The choice is up to you. If you read the case and if the case is a deep bite case, then you have to click the correct the deep bite. By click correct the deep bite, this one they will ask you how you would like to correct the deep bite. First choice is by intrude the anterior teeth only. Then the second choice is to intrude the anterior teeth and extrude premolar. So with the deep bite case, you should look at the facial profile of the patient too. If patient lower facial height is short, then you can choose to intrude the anterior teeth and extrude premolar in order to gain the lower facial height of the patient. Okay, so just as example, maybe my case I'll choose to intrude anterior teeth and upper only. Once you finish, then you click next. Next question is about the biram. I'll show you the picture of the biram again in case you may forgot. The biram is an aligner feature that will come with the aligner. That will, in the clean check, it will appear in green color. What the biram does is that it will disocclude the posterior teeth. So biram can be useful in a deep bite case that you would like to disocclude the posterior teeth in order to extrude the posterior teeth and gain the lower facial height. So for the biram, if your case is not a deep bite case, you should click none. But if your case is a deep bite case and you would like to get the biram feature, you can click to place biram on lingua of these upper teeth. And then they will ask you to choose between incisor placement, as in these two photos on the left, is a biram on the incisor for teeth, or the biram on the canine, like a photo on the right side, the biram on the canine. Between these two, it depends on patient overjet. If patients have overjet that larger than 3 millimeters, you should place a biram on the canine. But if patient have overjet less than 3 millimeters, you should place the biram on the incisor. Okay, so once you finish this one, then you click next. Next question is about patient midline. At this stage, you should look at patient smile photo, and then you should indicate the facial midline and dental midline, upper arch and lower arch. If patient have any midline shift and you would like to correct midline with IPR. If patient have an upper midline shift to the left, you should click to correct upper midline to patient's right. But if patient have upper midline shift to the right, you should click upper and improve midline to patient left. Okay, and the next question is about posterior crossbite. If patient have a posterior crossbite, would you like to correct that crossbite or not? If you would like to correct the posterior crossbite, you click correct. But if you doesn't want to correct the posterior crossbite, then you click do not correct. Okay, once you finish, then you click next. Okay, so next question will be about the spacing and crowding. So you look at your case, if there are any spacing, and if you would like to close all the space, or if you would like to open some space for prosthesis. If your case is a spacing and you would like to close all space, then you click here to close all spaces. But if your case have some space and you're planning to open that space, maybe for prosthetic purpose, then you can click to leave a specific space. And then it will show in the two diagram. In the two diagram, if you have a space that you would like to open for prosthesis, you can click in here on that tool, and then you type in how many millimeter you would like to keep it open. As an example, I click that I would like to open space between 3.6 and 3.7 for 8 millimeters. 8.0 means 8 millimeters. And when I close this one, it will show in here. Between tooth number 3.7 and 3.6, leave space for 8.0 millimeter. Next one will be about crowding. If it's a case that have a crowding, how would you like to correct it or how would you like to resolve it? There would be 3 mechanics that you can choose. The first one is that you would like to correct the crowding by expansion. The second one is you would like to correct the crowding by proclination. And the third one is you would like to correct the crowding by IPR. You can choose to have all, or you can choose not to do some of it. And in here, you have primary, as needed, and none. For primary, it means that you would like to resolve the crowding of the upper arch by expansion primarily. It means to do the expansion first to gain all the space needed. But if you click as needed, it means that you let the lab do as needed for that case. No need to do the expansion first, just do it whenever it's needed. But if that case, you check and then the arch is already broad and you doesn't want to expand anymore, then you can click none. It means that do not expand upper arch anymore. So here is that how to correct the crowding. You have expansion, proclination, and IPR. And with this one, primarily, as needed, and none, is that the priority of the mechanic. If you would like to do the expansion first, then you can click primarily. But if you would like to do it anytime as needed for that case, you can click as needed. But if you doesn't want to do any expansion, then you click none. So you have to click in all of the 5 things. Depends on the priority. This one is for the upper arch, and for the lower arch would be the same. They will ask how you would like to resolve the crowding by expansion, proclination, on IPR. And if you would like to do it primarily, as needed, or none. So you click depends on your case. Once you complete all this, and then you can click next. Next question is if you plan to do any extraction in this case. If it's a very crowding case and then you think that this case may need to do some extraction, you can click extract these teeth. And then you click on the teeth that apply. For example, maybe tooth number 1, 4, 2, 4, 3, 4, 4, 4. So depend on your case and your plan. But if your case is a non-extraction case, you can click none. Okay, then I click next. The last one is a special instruction that you would like to write any information about this case or any final result that you would like to get. For example, maybe you would like to finish with overbite and overjet for 1 millimeter. Or any special instruction that you would like to add, it could be about the occlusion. Maybe you want to finish with heavy occlusion on posterior teeth. It would be anything that you cannot tell them in the previous questions. You can write it in special instruction here. Okay, so you can write anything that applies to this case. Once you finish, then you can click next. Okay, when you click next, it will run for you to check again about the previous impression or scan that you already choose. If it's the correct one, then you can click next. And then they will request you to check the photo again that you already insert, if it's a correct photo or not. If the correct one, then you click next. Okay, because it's mine, like I didn't upload any photo, so it didn't allow me to go through. Okay, so maybe I'll choose to upload some. Okay, and then it will run for you to check the radiograph. If you would like to upload anything, or there will be no radiograph. If it's the correct radiograph, then you click next. And the next step is a special offer discount. With our country, Thailand, also we don't have any special coupon, so we click none. And this one is a prescription form summary. They will summarize all the information that we put in this case. It will be comprised of patient name, the arch to treat, that we would like to treat both arch, upper arch and lower arch, and the tooth movement restriction. In my case, I key in that number 16 is an implant, so shouldn't move it, so it would be in here. An attachment that I choose, that I don't want to place attachment on 4-6 because it's a crown, so it will present in here. And the AP correction of my case, I plan to correct to class 1 canine and molar by do the posterior IPR and sequential distalization. And I would like to improve the overjet of my case. And I would like to correct the deep bite of my case by into the upper anterior teeth only. And I don't want any biram in my case. And I request to improve the midline, upper midline to patient's left. So this one is a summarize the information that we have put in. If you review it and if it's all correct, then you can click submit. Once you click submit, it will be in the process. Okay, so yeah, this one I finished with the submission process. I'm sure the team will stay there and help you with the submission. So for now, I would like to open for some questions that you would like me to answer. If you have any question, please tell Kun Chu from Myanmar side, and please tell Pom Pam from Cambodian side. I'll stand by to answer some of your questions, if there are any.
Any questions?
Okay, so go to this one, how to select patient. This one? Okay. Okay, another question from Kun Chu is that if there are loss of attachment on stage 30 during the treatment, how do we reattach the attachment? Okay, so if there are any loss of attachment in between treatment, you can order a new attachment template that apply on that stage. For example, if you have lost attachment on stage 30, you can go into patient, into Invisalign doctor side, then go to that patient, and then there will be the attachment template button that you can click and then you can order the new attachment template without any charge.
attachment ဟုတ်တယ်ဗျာအဲ့ stage study ကခုန stage study လိုမျိုးပဲအဲ့ attachment ကိုကျွန်တော်တို့ attachment template order အသစ်ထပ်မှာပြီးတော့charge ထပ်ပြီးကြမလို့ပဲနဲ့ order မှာလေးရပါတယ်ဗျာ
impression လို့လားအဲ့ဒီမှာ
ဟိုလိုမျိုးလေ template ကတော့ကျွန်တော်တို့မလိုဘူးထင်တယ်ဗျာဟုတ်ဒီ stage study တို့
In
attachment
case that you lost some attachment and it's ongoing,
but it's